Welcome to MHS 520, Diversity in Healthcare. I'm Dr. Tori Cobb. I'm an adjunct assistant professor in the Master of Health Science, Master of Medical Science program at St. Francis University, and I will be the instructor for this course. My doctorate is in health science, and I have a master's degree in health science and in public health, epidemiology, and biostatistics. My clinical degree is as a physician assistant. I have 17 years of clinical experience as a physician assistant, primarily in neurosurgery, but also trauma, general surgery, OBGYN, and emergency medicine. I have taught in U.S. programs and online at the University of Queensland PA program in Australia. I have managed PA program student rotations in Kenya, China, Costa Rica, and Honduras. I have published articles in a variety of peer-reviewed journals, as well as authored textbook chapters in board review books. I've also authored chapters for a physician assistant, Guide to Clinical Practice, and the Encyclopedia of Trauma Care. I have lived and worked abroad. I am married. My husband teaches economics, and we have 2 children. Our son is in graduate school in bioengineering, and our daughter, who was adopted from China, is 11 years old. My hobbies include reading, downhill skiing, water sports, and international travel. I look forward to getting to know all of you. As this is an online course, I do not maintain regular office hours, but I can arrange to speak with you via Skype, WeChat, or by phone anytime if needed. For routine matters, there are 2 options. Please use the Messages feature within the course to contact me directly regarding private matters related to the course, such as Blackboard technical problems or grades. Otherwise, please use the open discussion forum in the discussion board page for general questions related to the course. A good rule of thumb is to ask yourself if your classmates would benefit from knowing the answer to your question. If so, then please post the question on the discussion board. I do have a St. Francis email, but I check that much less frequently, so please use the Blackboard Message Center to contact me. The course is 3 credit hours and is delivered completely online in an asynchronous fashion. We will be examining the cultural influences that affect health beliefs and health care. The United States has an ever-growing population rich with racial, ethnic, religious, linguistic, and cultural diversity. Unfortunately, diverse populations suffer disproportionately from a wide range of health problems, including cardiovascular disease, diabetes, and cancer. Infant mortality rates are generally higher, and rates of childhood immunizations tend to be lower in these groups. As awareness has grown regarding healthcare disparities, so has the movement to educate healthcare providers in order to provide for diverse populations. The first step is to teach culturally competent care. This means that race, religion, ethnicity, language, and culture are all considered when caring for patients. This term, students will be designing a program to deliver culturally competent care. The textbook that I have selected for the course is Cultural Diversity in Health and Illness. This is a well-known and well-respected publication in its 9th edition. My motto is Life Happens. We all have a variety of commitments, school, work, family, etc., and sometimes things happen that are unforeseeable, such as injury or illness. Please do not hesitate to let me know if you are having a problem in your life that is interfering with this class. I'm happy to work with you. The sooner you communicate the problem to me, the more I can help. However, you must email me before the assignment deadline. Please be aware that missing an assignment deadline without prior arrangements will result in a 0 as stated in the syllabus. Even with prior arrangements, there may be a penalty for completing assignments late. If you do miss a deadline, please email me with the circumstances. I may be able to help you with some extra credit work. Just let me know if you are having any problems. I want to see you succeed.